Good Saturday morning, everybody. You know, we all know about mental illness in adults, but what if you're worried your child might have a problem? So who do you go talk to? You know, most families will turn to their primary care doctor or pediatrician. This morning, Dr. Mark Salerno joining us here, and sometimes mental health can certainly be tied to physical health as well. Is this something that we see a lot in kids, and how do we know what's going on with them?
Well, we know very well now that physical health and emotional or mental health go together. Children who are emotionally healthy tend to be physically healthy and vice versa.
Okay.
So you can never look at one without looking at the other. And then we're talking about health problems that go through generations with this child. So a child who has a lot of trauma, who isn't doing well emotionally now at the age, say, 8, will have health problems in their 30s, 40s, and 50s.
If you don't get it corrected, huh?
Yes.
What are some of the earliest ages that you're seeing with kids having mental health issues?
Well, if we stay away from casting it as a mental health problem and we look at it as an emotional or a behavioral or a family issue, you start to see these things very young. You'll see 15-month-old kids whose behavior is just not acceptable to the family.
Like what? What are some examples of parents out there that have kids and you think, well, I don't see it as a parent, but maybe it truly is something that needs to be, I don't know, remedied, I guess.
Well, I think we all see tantrums in our children.
Sure.
And the question is, when is that tantrum too much of a tantrum? And that becomes a question. I saw a picture of someone in the Oval Office with the president, and a 3-year-old was laying on the ground having a bit of a tantrum there. And, you know, so if it's too much for the family feels like they can't control it, that it's out of the ordinary, then that's the reason to come to the pediatrician to discuss it.
What are some other things other than a tantrum? You know, because I think of, okay, laying down on the ground because the child's not getting his or her way. Grocery store, same thing. The child's not getting the item they picked off of the shelf. What are some of the other things outside of just tantrums that you see in kids?
You see sleep problems, learning problems as we start to get a little older. We're talking about substance abuse issues, talking about bullies and being bullied, talking about, and then on the more severe end, we're talking about depression, anxiety, eating disorders. There's a whole array of things. And the sooner we approach all of them, the better it turns out to be.
How long does it typically take if you find a child that has a mental health issue? How long does it take for them to get past it?
Well, you could be talking anywhere from a few visits to many years of getting help. For instance, a child who's having tantrums, to go back to that, and you teach the family some different ways of intervening, you may solve that problem within a couple of visits.
Now, is this something that is covered typically by insurance companies? If they show up to the pediatrician and say, hey, listen, I think I've got this issue with my son or daughter, will it be covered?
It's typically covered. One of the big issues, and people need to advocate for this, is even though parity was supposed to come into being, meaning mental health and physical health are supposed to be treated equally under the law, under the Affordable Care Act, that has not come to be in its entirety, so that people have to push for that. You're entitled to your child getting the health care they need, regardless of whether or not we want to separate it out to being mental or physical health.
And again, the message this morning is catch it early and take care of it, because it could progress into something more severe as they get older.
And remember, there's nothing we don't want to hear about. If it's an issue to your family, the pediatrician wants to hear about it.
Yeah. Dr. Salerno, appreciate it.
Thank you.
Thanks for coming in on a Saturday morning. Yeah. All right.